Exactly. So face yoga is a holistic approach to aging. They have fewer wrinkles, they regain tone and firmness, especially in the cheeks, around the lips, on the eyelids and so on. And they also have more glow, angriness and so on. And this will leave kind of permanent imprint in the muscles. And you can make round movements with the fingers while breathing deeply.
I'm joined today by the French expert in face yoga, Sylvie Lefranc, which has now written her fourth book on how to do yoga, face yoga at home. And today we're going to explore the interesting connections that we have between my specialty, which is dentistry, and the material which she teaches. So, Sylvie, thank you very much for accepting the invitation.
With huge pleasure. Thank you for having me.
With great honor.
Thank you.
Could you please tell us what face yoga is and what made you go towards this new, very exciting field, which people talk so much about today?
Exactly. So face yoga is a holistic approach to aging concerning the face. So we really want to prevent all the manifestation of time on the face, being wrinkles, lack of tone, and also lack of glow and so on. So the main material on which we work in face yoga are the muscles. We have a lot of muscles on the face. Some are much used also in the mouth, exactly, in mastication. So we know that these muscles, of course, they have a lot of influences with time. They can lack tone, they can lose density, and sometimes also be overworking, creating many wrinkles on the face, for example, the forehead, between the eyebrows, and so on. So the idea is to identify what the muscles' needs are, and then to answer these needs with various exercises. We also work with the fascia, which is a very important tissue made of collagen, elastin, hyaluronic acid, and so on, which has an amazing ability to restore itself if we know how to talk to it through massage especially. So we work on muscles, we also work on fascia, and of course we also work on the epidermis through, for instance, cosmetic care.
And what are some typical results that your clients have after applying these exercises?
So they have fewer wrinkles, they regain tone and firmness, especially in the cheeks, around the lips, on the eyelids, and so on. And they also have more glow because you improve all the circulations, lymphatic circulation, blood circulation. So your face is more alive and glowing after face yoga exercises.
I think that might interest lots of our viewers.
Exactly.
We see, especially nowadays, lots of people, which, especially in my office, I see patients which have troubles with their articulation and masticatory muscles, which we talked about, which are very stiff, and lots of them grind their teeth or clench. Does face yoga have any solutions for that?
Yes, it has. I also see among my clients a lot of people suffering from tensions in the jaw, which are extreme. So some of them, they just wake up in the morning, they have difficulties opening the mouth wide. So this is a real issue, and this has a lot of aesthetic consequences also because it creates more nasolabial lines. It also makes the mouth like crimpled in a face, and it also has a consequence on the volume of the jawline. So aesthetically, having a lot of tension in the jaw has a lot of consequences, and face yoga has an answer through inner mouth massage, because we can really grab all these muscles by going inside the mouth, and every evening when you just wash your teeth, you can have a 5 to 10 minutes movements here when you really relax all the tensions you can feel between your fingers by this kind of fresh and relaxed movement, vibration, and also round movements around the joint, which is usually very tense in people who suffer from this kind of...
Very often when I do palpate these areas, the pterygoidean muscle,
exactly,
sometimes there are some tears coming out, but
yeah, because it's
it's
so
very tense.
painful. Exactly. And the idea of face yoga is that you do things regularly, daily,
Yes.
if possible. So you can really work on the tension step by step. And then when you go to your dentist, you say, oh, wow, amazing. I can open my mouth and I don't feel so much pain. It's easier. Because even if you go to the osteopath, which can be extremely important, usually the osteopath goes inside and presses so hard, it's so painful. So the idea is that you do things by yourself, step by step.
Slowly. And daily.
Exactly. And you can do it in the evening, but also in the morning, once again, when you wake up. And you don't have to be seated or standing to do this massage. You can be lying on your bed. You have also, of course, clean hands, and you can do this very slowly and relax your nervous system, because usually people who have much tension in the jaw, they are under such a level of stress in their daily life that their nervous system is like expressing itself, saying, have you seen how tense I am? So this is also very relaxing. So even for best quality of sleep, having a relaxed jaw is a good thing.
Basically, it's self-care. You're learning to love
Basically
yourself.
self-care, exactly.
And take care of your body, which is your temple.
Exactly. Exactly.
What are the long-term effects that you noticed from your clients that apply these techniques of face yoga constantly?
For the jaw or globally?
Especially for the jaw.
Especially for the jaw.
Are there any improvements, and after what time? And how do these people feel? Is there any? We talked about the parasympathetic nervous system. Is there any calmness which is brought by these exercises in the entirety of the person, and especially their rumination, which is very often in these types of patients?
This is rumination place.
Manifesting.
Exactly. In Chinese medicine, it is the stomach meridian that is here, and it is linked when it is imbalanced with anxiety, rumination, and so on. So this is a very, very important place. Yeah, I've seen very positive results, especially if the client also combines face yoga with other mindfulness techniques. Face yoga by itself, working on the body by itself, is a huge step. But if you are still under the same level of stress in your daily life, you will just try to let some of the stress go out of your body.
Or maybe even nervously pull on your muscles.
This is also a very important point, and thank you for mentioning it, because sometimes my clients, when they show me how they massage their face, it's like a struggle. It's like they go inside and very strongly and also very quickly. So I feel we really need to learn again to be slow, because slow movement will really bring the body a consistent message. Okay, I'm about to relax. And we know that if we talk very quickly, then we feel something like, okay, the nervous system
and the heart rate
exactly is starting to be like, okay, this is something quick and I have to be quick in my motions and so on. And my brain also is about to work very quickly. If someone talks very slowly, and if someone massages the face very slowly, then something happens deeply in the body. So face yoga alone, the movements, the massages alone are not enough. They are a huge step, physical step, a step also in the consciousness, but they are not enough. You also have, I feel, to change what in your daily life makes you under a huge stress. If you don't change anything, that's hard.
Right.
You can see some effects, but there will be short-term effects, and in the long run, you will be back to your bad habits of clenching very hard.
And do you ask your patients what in their life contributes to the stress, so they can pinpoint exactly where they can, what they can work on?
Exactly. At the beginning of a face yoga private course, I ask a lot of questions about the the client daily life, eating habits, drinking habits, sleep, digestion, and stress, emotions, and so on, so that I have kind of consistent picture of what the client lives in his everyday life. And so this helps me give the right exercise, but also give the other practices that can be used to feel better. Because face yoga alone may not be enough.
You are doing holistic face yoga, and you also have a big part of traditional Chinese medicine embedded in your approach, which I find absolutely fascinating.
Yeah, because I feel we can't age, I will say, joyfully and gracefully if our body is suffering, and if our mind is suffering, and if our emotional body is suffering. So age is an opportunity to go inside and say, okay, what's going on, really? And how will I answer positively to what my body, my mind, my emotions are telling me? But I have to listen to it. And a wrinkle is a message. An evolution in the face is a message. Of course, we age, and of course, things change. That's normal, but they will change. I'm sure we can age in harmony and grace and joy if we are connected to our body and listen to its needs, which are, of course, increasing with time because it's becoming a bit more fragile. That's life.
I like how you said grace, because that's exactly it.
Exactly, and beauty is not for me something that is like perfect plastic. This is, we are not dolls, so we are alive human beings, though we have, of course, things that are not just right perfect, but I think perfection is not something that is necessarily beautiful. You know, I saw some pictures of faces that were totally duplicated, because naturally we have asymmetrical faces, which is totally natural. And some aesthetic doctors, they duplicated the face, and the results were like...
It's ugly. I saw those as well.
I said, oh no, I don't want to be perfectly symmetrical, because in nature, things are not perfect.
That brings me to another question I had, because in dentistry it's very important to have a balance between the muscles, because if you have, let's say, one muscle which is going to slightly move the jaw in one place, and that's very often the case when people have braces, and maybe the approach wasn't the holistic approach, where you look outside the mouth and the teeth as well, and they might have one small contact, and that contact is going to oblige the jaw or the brain to command the muscles to put the jaw in a different position, and that's going to create imbalances. How does face yoga help with balancing the muscles and also balancing the face, the aesthetics?
In face yoga, we are tracking excessive muscle tensions. Usually, people come to face yoga saying, okay, I'm losing my definition of the jawline. I feel my face is going down, so please give me exercises to train my muscles and
to strengthen.
Yeah, and strengthen. And I said, no, not the first step. That's what we developed with Ena Narumi, the Japanese specialist, in the last book. No, this is not the first step. The first step is to track all the tensions you have everywhere.
Yeah, I saw in the book you start with relaxing.
Exactly. This is so important because, as you said also, how do you put your shoulders? How are your hips? How, if you are all day like this because you are in front of your computer, or you hold your bag only on one shoulder, and so this creates a lot of imbalance. You have so many tensions everywhere, and in the end, you will have your face that will become even more asymmetrical. And then you will also start using your muscles in a bad way. So we first start with relaxing all the tensions we have, which are not necessary. And then we are back to a stage of alignment. And then even for mastication, for instance, some of my clients, they only chew with one side of the face. And when I said, do you chew only with that side? I said, let me think. Yes, I do. I never chew with that side. So of course, this creates a huge asymmetry in the jawline, the cheek muscles, the lips also, which the corners are totally unaligned. And this comes from chewing.
Yes, and they might have one missing tooth or one
Exactly.
cavity. They can chew on one side, so they switch to the other.
And then they forget.
Yes.
They forget that they can use both sides. So it happened to me. I remember when I was younger, I had
the wisdom tooth?
Yeah, exactly. Removed on one side, so it was very painful and so on. And then I started chewing only on one side. And then it was a real education process to say, okay, no, Sylvie, you can use both sides of your mouth to chew. So
actually, that's what we do with orthotics, where we try to eliminate these tensions, and we put the jaw in the right position, and the patient has to re-educate his functions by having this. It's sort of a splint which is going to oblige the patient to work his muscles in this new centered position. And I feel face yoga is very useful in these cases where, as you said, you have one side which is overworked and very tense, and then we have to switch, basically renounce this tension so the jaw can go back to the other side.
Exactly.
And that's where you can do some muscle detensioning. And I saw in your book you have the face pointer.
Exactly.
I think that would be a great addition to quickly, or
exactly.
How would one use the face pointer, and how can that eliminate the tension?
So this is a tool that is that was designed in Japan, and the idea is to have a very deep impact on muscles, even the deepest muscles.
Deep layers.
Exactly, because it has a vibration, strong vibration, and you can either go inside the mouth and grab the muscles, or use the face pointer outside, and both have almost the same effect. So for people who find it very hard to go inside the muscle, or who are just at the office, for example, you can't just go inside your mouth just in front of your colleagues, or because you don't have clean hands. So the face pointer is amazing, and many of my clients use it for tensions in the jaw.
And it's discreet, it's like a pen.
Exactly, you have it in your bag and you can do it everywhere at any time. This is so easy and very quick impact. In a few minutes, you really feel how much relaxed all the tense muscles are usually.
We also talked about, you talked about the oval of the face and how that changes. And that makes me think about the tongue posture, which for us is very important. And you see people who are nose breathers, they have this harmonious face, and as soon as somebody is going to maybe have some difficulties in his nose to breathe correctly, as soon as they switch to mouth breathing, it's a whole cascade of things that start to go downhill, including there have been some studies which show that we have nitrous oxide production when we breathe through the nose. It's very important for the brain, because it's going to cool down the brain, it's going to filter the air, and all of this stops, and then you breathe through your mouth. And you're going to see these patients, they have this long face, and the tongue which is going down, so it's going to affect the lower part of the mandible.
Exactly.
Does face yoga have any answers for correcting? Because I know you talk lots about the oval,
the jawline.
The jawline.
Yes, it has. So breathing is something very important in face yoga, because face yoga has this yoga part, and I myself a yoga teacher, a yin yoga teacher, and breathing is very important. You just can't have glow in your face and balance in your body if you don't breathe properly. And as you said, it is very spectacular how you breathe, be it through the nose or through the mouth, impacts the architecture of the face, but also
especially in children.
Especially in children, and also the eyes, because mouth breather, they will have hollow, dark under eye area, and their tongue is not position clearly in the mouth, and then we also have a lot of issues with the teeth in the end. So this is a kind of nightmare that is being created with time. So I'm working with a re-education to put the tip of the tongue on the plates. This is so important. Usually they come to me not for breathing, because this is not something they think we will talk about. They say, I have double chin. This is really annoying me. I can see on my profile, on pictures, I see this double chin. And then I ask, okay, close your eyes and let me know where your tongue is spontaneously placed in your mouth. I say, okay, down. Okay, how do you breathe? And I can see that the person is like, you can observe, even in the metro, for instance, some people, they're like, and you say, okay, this is not normal. Normally, mouth is closed and it's just open to speak and eat, not for breathing. So, yeah, we work on this also in face yoga practices to gently close the mouth, invite the nose to be the real breathing organ. And we also have some practices when you can rub here to open this sinuses. You can also stimulate an acupressure point here, which is on the large intestine meridian, which is very good to open and be able to breathe better again. And also consciousness. Consciousness is key, because in today's world, we are very conscious on everything happening all around, especially on social media, but we don't feel our body anymore, except when it's very, very painful. I say, okay, this is painful, or we have aesthetic manifestation that we don't like. We say, okay, I have to do something, but we don't feel the body. So being back to feeling the body, being conscious, how am I breathing now? Mouth closed, air in and out of the nose, and tip of the tongue on the palate.
What would be a great exercise? You talked about rubbing the nose. How would someone do that?
You can also add maybe a drop of essential oil, like pine or something like that, that will help you breathe more deeply. And also, there is one practice, pranayama practice from the yoga, which is, it is called Brahmari. And so you close your ears, you close your eyes, you inhale through the nose, and you do a humming sound like this. And this is very good because it opens everything. So even if we have a cold and we find it difficult to breathe through the nose, it will really open everything and makes it easier. Also, alternate breathing, so that you can identify if there is one nostril that is blocked, and then you can do this many times, so that in the end you say, okay, I feel that my body is back to its natural and good breathing method.
What I like about yoga is that it brings you back in consciousness of your body. You get to rediscover your body in a way.
Exactly, and this is very important, and what I also very happy that doctors like you exist, because sometimes we just we don't learn. In fact, we don't know. When we see animals, this is impressive. Animals, they know how to heal themselves. They know when they are sick, and they don't read guides to know what to eat, how to sleep. Nature knows, because it has this deep knowledge, because it has this self-consciousness of what is good to be alive. And as human beings, we have lost this. So we need guides, we need podcasts, we need internet to know what we have to eat. ChatGPT. How come that we have lost this inner sense of consciousness that naturally makes us feel what is good for us or not? So we have lost, but this is a step that gradually, as we age, this is very beautiful. Age for this is very beautiful, that we are back to this consciousness of the body and connection of the body. My body knows. My mind doesn't know, my brain doesn't know, but my body knows. So I have to listen to my body.
In dentistry, we focus a lot on the lower third of the mouth, and especially what happens in between the lips. And we pay some attention to, for example, the lips, the support that they have. If you have missing teeth or people without any teeth, often you see the lips which go back.
They recede.
Yes, but that's about where we stop, I'd say, or the cosmetic dentistry stops. We take care of the mouth, and then patients often go to a surgeon or a cosmetic practitioner because they want to improve all these furrows that they have, the lines, the smile lines. And what they usually get is a small shot of hyaluronic acid, small shot of Botox. And I'd like to ask, what is your opinion about the hyaluronic acid and all these injections? How does that influence the fascia and the overall body tone? And how can face yoga give some answers to that?
So that's true that nowadays we have a lot of possibilities to improve the face appearance, and people can really rely to many things, and aesthetic medicine have the advantage of being very quick in effect. So this is an answer, and I feel that if someone is really depressed about their appearance and think that seeing oneself in the mirror is like a nightmare, I feel it can be very supportive to have the possibility to act very quickly and say, okay, I feel back to my normal face and I feel more confident, and so I feel better. And this is, in that cases, I feel it's good. In face yoga, we usually don't use any other
synthetic
things,
products,
because we just use what the body naturally has, being the muscles, the fascia, and the skin. And my personal opinion about it is that circulation is key. So as you said, I was trained in traditional Chinese medicine. I was also trained in acupuncture. And in this view of the body, it is extremely important that everything circulates and movement is key. And I just finished a training in Moon's floor. I don't know if you know.
Yes.
It's
very slow movements.
It's a very slow movement. So I practiced for myself for many months and said, okay, I want to become a teacher. So I finished my training 2 weeks ago in Moon's floor because it works on fascia and it's an amazing practice. And once again, in this kind of view, movement is key. So the idea that you just stop any part of the face to move to prevent wrinkles appears like a contradiction. You say, no, because this part needs to be alive and need movement to happen continuously, because there are meridians crossing by, blood vessels, lymph circulation, and so on. So that's true that there is a small contradiction between these two approaches. But as I said previously, if someone really feels bad with their appearance, I feel it's good to have the ability to change something and feel better. What face yoga brings as an answer is to work on the muscles here. Lips are a muscle, so you can work on the muscle volume by toning the muscle, relaxing the muscle, massaging the muscle. So that's the answer face yoga gives, to really work on this lip muscle to bring back volume, and also pay attention to all the expressions you have in your daily life. When you look at people, they have so many expressions they don't realize with their mouth. And when they come to me, I say, okay, I don't understand why, but I have a I have a line here. And I say, have you noticed that you are just 10 times per minute doing? So of course you will have wrinkles. So this is also this consciousness part. Think, no, you don't need to prevent totally your muscles from moving, but be conscious of all the movements you make without realizing, and let your face be totally relaxed. And then automatically you will smooth wrinkles around, and you will be back to a normal volume of lips.
And I think that ties very well with what we do, because in dentistry you look at teeth, and then orthodontics is going to go one step further and look also at the dynamics, especially functional orthodontics. you have the dynamics of the muscles which are on the outside, which is the buccinator, the orbicularis oris, and the biggest muscle of them all, which is on the inside, the tongue, which we talked about. And the teeth are going to position themselves in between
all these
two
muscles. Exactly.
So if we have, let's say, the orbicularis, your lips, which are always
pressing on the teeth.
Go back.
Exactly.
And you can, slap an Invisalign, push the teeth in front, and then what happens most of the time, we either put another contention or we put a bar behind so that they don't move back, but we have to start thinking, why are they going back? And most of the times there's some muscle which is working too hard, which is going to pull or push the teeth. And that's when...
Exactly. And this is what makes also something very long-lasting if you don't take care of the muscle, like for the body. Also, many people now, they are just like this. So you say, okay, this is much better for your jawline as well, because if you are like this all day and like this all the time, it will have a huge impact on all these also muscles, and it will eventually impact your aesthetics.
Maybe we should put our cell phones behind, so that way you stay straight and try to look in the mirror.
That's it. No, exactly. So muscles are very important, and sometimes we forget that the bones move according to the muscle pressure.
Yes.
So,
and even as an adult, they still move. And you can ask any osteopath, he's going to say, yes, bones do move.
Exactly.
The sutures aren't sutured.
Exactly.
And basically are the muscles. I know I went to a course, and that really stood with me. They said muscle is going to always beat the tooth or the bone, which means consistent muscle pressure is going to either crack your tooth, either put your tooth in a different position, or create all kinds of stuff.
Exactly. I remember I had one client, she had so much tension in the jaw that when she woke up in the morning, she had bits of tooth in the mouth.
Yes, we see that all the time.
And so this is the proof that teeth cannot resist high pressure in the mastication muscle. So working with the muscles is really important. And as we said also, it goes far beyond beauty. It's the preservation of the whole body resources.
Whole system, yes.
Exactly.
The body is very well, we talked about nature earlier, it's very well built.
Exactly.
And it has the tools to heal itself. But if we don't pay attention to the small signals, that's where trouble happens.
Exactly. And we say, okay, what makes the body be so stressed that there is such pressure in the jaw? And usually you think that the client has a daily life that is not at all aligned with their needs. In fact, they are overstressed. So they are really depleting all their resources. And this is the alarm signal in the jaw.
So when you see some patient with his jaws like a pit bull, you know he's stressed.
Exactly.
And in holistic dentistry, we talk about this, and I'm trying to gently tell them that maybe there are some things that they can't express, or they fear to express.
Exactly.
Because basically that's the signification and symbolism, that you have things that you have to keep your mouth shut and ruminate in your mouth.
That's so true. Exactly. Usually this is sometimes very long in the past, in childhood, the message that was given to the person is that it's dangerous to talk, so keep everything inside and go ahead. But at some point the body just can't stand it anymore. So they have to talk and be able to say things.
To flow.
Exactly.
Everything has to flow.
Open the mouth and let it flow. Exactly.
There's a psychologist, Paul Ekman.
Yeah.
Have you heard about him?
Yeah, I read a lot of his books about facial expressions.
Me too.
Oh.
So you know about the 7 universal emotions.
Exactly.
And he said that emotions are normal, and we're going to have these expressions on the face, and even micro expressions, because that's the part which most interested me, in seeing how people express in 1/2 of a second, either contempt or surprise or etc. But he also talks about having these emotions that last too long. Usually it should be a maximum 1 hour, but if it's too long, it's going to imprint on the face. And I think you see that most of the time in your practice. Could you talk about how these emotions affect our face with the wrinkles? And
Exactly. So Paul Ekman really identified the links between each muscle on the face and the emotion. For instance, the forehead surprise, the mouth here disgust, and so on. So in fact, indeed, we have subtle expressions with the face each time we are crossed by an emotion. When the emotion becomes permanent, and this is also very good to make the link with traditional Chinese medicine, saying that according to the elements we have most in the body, we are more prone to some emotions. Personally, I'm prone to sadness, which is an emotion I can have a lot. And when I'm very sad, it can be very hard for me to go over sadness. Less and less now than I work on myself. When I was younger, I could be sad for so long and crying and think that I would never be happy again. So for me, it's sadness. For some people, it will be anxiety or angriness and so on. And this will leave kind of permanent imprint in the muscles. Not only in the muscles, but especially in the fascia, because the fascia over, which is around and over the muscle, will keep the memory of the tension. And then we will have a permanent communication between the mind and the emotions and the body. We have the emotion and it has an impact, physical impact. But if physically we keep the tension, then we keep on sending to our brain the message that we still have the emotion.
The mind-body connection, which is always
exactly. And so this is vicious circle. We are very tense and we delve into that emotional state. And this is where face yoga can be very precious also, because when you go deep into the muscle, relax the muscle, relax the fascia, smooth the fascia, then you say, I can feel better eventually. Even when you receive a massage, we talk about fascialist massage, just your face is massaged, but you go out after the treatment, you say, I feel so much better, so much light and happy. Nothing more than the face has been massaged, but the whole body and the whole emotional body has been treated. So that's connection from emotions to muscles and muscles to emotions is working on permanently. And what happens with the face, that we have all the sensory organs on it. So this is such an important part of the body. We see, we hear, we smell, we taste, and we feel. So the face is like strategic place to work on, to be back to balance at any levels.
Yes. Given that you and I, we both see patients which want to appear younger or want to reduce the tensions and feel better in their own body, how would you approach someone who just had, for example, veneers or had some cosmetic treatment? How can face yoga improve or take their facial aesthetics to the next level?
So daily massage, being in touch daily with your face is, I would say, a real reconnection with the body. So usually we approach beauty through the eyes. We say, okay, do I look beautiful? Do I look young? Do I look... And we know that what we see is very, very influenced by our brain. The eyes are not a very authentic sense, but touch is very authentic. If you feel what you feel, but you don't see what you really see. So usually people, as you certainly see also among your clients and patients, they see themselves far more aging and than they really are. They focus on something and then it takes all the place in their brain. And I see when they come to me, say, I have this wrinkle, I don't sleep because of it, I feel so ugly. And I said, Really? Because personally, if you hadn't mentioned it to me, I wouldn't have said it was an issue on your face. So the eyes is a sensory organ that is very manipulated by our brain. And now we have a lot of images of what a beautiful face is.
How great my life is, how beautiful
Exactly.
my face is.
I have an amazing life.
With 10 filters.
Exactly. I have amazing holidays, an amazing home, an amazing family, an amazing face. And so people feel so fragile. They say, I don't have this amazing life. I don't have this amazing home. I don't have this amazing holidays. And eventually, I don't have this amazing face. So touch is very important because you go beyond the eye perception and you really feel what's going on. So this is an amazing way to reconnect to your body. And for people who have treatments, dentary treatments, like Invisalign, for instance, face yoga can help because usually it modifies something, especially with deglutition. Because some saliva accumulates and they do a lot of these kind of movements, and sometimes they end up with more wrinkles around the lips after the treatment.
At the end of the cosmetic treatment.
Exactly. So they are very happy with their teeth alignment, but they say, oh, I have these wrinkles here because I do all the time. So usually what we do is that we work on this deglutition process, trying to keep the lips much more quiet. And we also use face tapes, as is also present in the book Ma Révolution Beauté du Visage. Because face taping, you can put it at night, so it comes from osteopathy and kine and so on. And it will also help your face be more relaxed and prevent some compulsive movements to be made, especially when you sleep. So face taping could be a very good also help to make the dentistry treatment as smooth as possible.
This makes me think about a book from the 60s, Psycho-Cybernetics, where a plastic surgeon did his treatments, his surgeries, and then he noticed that some people change completely and some people are still the same, which show that we all have a self-image inside. And as you said, what we see is going to trick us. And even though you're the most beautiful person, you won't see yourself as such. And then you spiral down and go in Botox and fillers. And
exactly.
We all know the cases on the internet that they have 20 injections and they resemble nothing anymore.
Exactly, but I also, what we feel that in the end, we also feel that they don't see themselves. Because you say, oh, what are this? They feel beautiful. They say, okay, something has changed in their view. But I imagine you have the same issue with the teeth.
Yes.
Because I guess some people want to have...
For us, it's perfect. And like, no.
Exactly.
I don't see any difference.
Exactly, because you have realigned something and I guess that everything functions properly. So this is your objective, even if it's not like perfect, absolutely perfect smile, which may not be consistent with the person needs. So,
and most of the sometimes they even want, like you said, perfection. So they want something which is perfectly symmetrical.
Exactly.
And white, like seashell.
Exactly.
Which does not exist in nature.
Exactly.
And some of these patients actually have a self-image problem. You can do the best treatment, or they're very perfectionist, and they're never going to see the beauty.
Exactly, of their own body. And you know, I talked to a plastic surgeon a few years ago, and he told me that some of his clients, they had so many nose operations because they didn't like their nose, so they go for a first operation. And instantly say, oh, wow, amazing. And a few weeks, months later, oh, no, this is no longer beautiful. I want another nose. And then another nose. And this is not physical problem. This is emotional problem. Self-esteem and self-love. And so, as we said at the beginning with face yoga can just do a part. But the work you have on your emotions and yourself is the other part. And it's definitely the most important.
Before we get to the exercises, what would you recommend people to do in the face yoga routine? What are some tips on the yoga part, as in self-connection and being slow and intentionate? what would be some tips on that part, so people can connect with their body, with their feelings, with their sense of touch, their breathing?
So I would say, yeah, the way they see it, each time they change the position of their body, to take a few seconds to say, okay, that's my body. I've changed position. How do I settle in this new position? I'm standing, I'm sitting, I'm lying, I'm running. How does it work? So to feel that, say, okay, I'm no longer in my brain for a few seconds and I feel my body. And this way they will reconnect gradually to their body. Then, how do I breathe? When I eat, how do I eat? I guess also for dentistry it's very important, but to chew properly, because
Yes,
now
I talk about conscious, because you hear conscious everything nowadays.
Yeah.
I talk about conscious eating and conscious toothbrushing.
Exactly. This is
breathe and feel what you're doing with your with your teeth and with your hand.
And this can make toothbrushing, which can be like, oh no, I hate this, which is usually the feeling we have. Oh, this is so nice, and I'm massaging my gums, and this is a me moment.
A ritual.
A ritual, exactly. So this kind of transition that you feel your body, because our body, I guess, is the real victim of our world now. We put into it very bad food, we breathe very polluted air, we drink very polluted water, we have a lot of poisonous thoughts. And I remember a sentence which is very simple. It said, your body can listen to anything you think. I said, wow, how many poisonous thoughts I had in one day about my own body. We create a daily life of nightmare for our body. And when it dysfunctions, we say, what? What happens?
How can he dare?
This is a scandal. You are no longer resisting. You are aging. You have wrinkles. You poor thing. And you say, okay, that's just my body. This is precious. So this is the first step. I would say face yoga is exercises, of course, for the beauty of the face. But beyond this, what we really want is this reconnection and honor, being able to honor our body. Exactly.
Before ending, could you show our viewers some exercises for clenching and relaxing the jaw muscles, and maybe some exercises for the respiration?
Yeah, so first, I would say in the evening when you are in your bathroom, before and after brushing your teeth, maybe mostly after, this is good. You can really also start by rolling your shoulders to open the chest, because usually we also have a bad breath because, as we said earlier, we don't have a proper position of the shoulders, so our lungs are like
collided.
Yeah, exactly. So we really need to be standing straight to be able to breathe properly. So round movement with the shoulders. This can be done also if you work behind your computer and you feel you are taking a very bad position. Also, feeling that you have like a pen between the omoplate and trying to hold the pen so that you really open the chest. And then massaging here the muscles on the side of the neck, which can be very tense, by pressing down one side and the other side.
Is there a constant pressure you have to do?
Yeah, exactly. This is quite intense pressure. 3 movements. Then also massaging the neck that you relax and also improve blood flow to the head. Then massaging around the ears, which are very connected to the jaw and temples. And then coming here. We have 2 acupressure points which are very relaxing for the jaw. The first one is just right here in the little hole. And you can make round movements with the fingers while breathing deeply. Second point is just here at the other extremity of the muscle. You can also make fists with your hand and make vibrations all around. Usually it's painful for people who clench the teeth. And you can also make some movements that you certainly know.
Yes.
to really open and stretch all the muscles. So this is good when you don't want to go inside the mouth. If you go inside, you can really grab the muscles from the inside. And then you will relax the temples, which are connected also, and stretch. And you can end by massaging points around the eyes, which are very good to relax the nervous system. So it will help also for the jaw. And you can make circle movements with your fingers like this. Or if you have a tool like a gua sha, for instance, you can make infinity movements all around, which is like afterwards you say, okay, I'm falling asleep. And for people who are very, very tense, I advise also to massage the scalp, because the scalp can be very, very tense. So to be able to move the scalp on the bone, I think there is no place of tensions.
Well, actually, we have a big muscle which goes from the front to the back.
Exactly. This is impressive. And in traditional Chinese medicine, we have a lot of meridians going through here to be then arriving on the face. So having a light scalp is very important for the whole face. And then you can stretch like a natural lifting. And it feels so good afterward because you feel a lot of lightness on your whole face. This is my favorite night routine.
Oh, excellent. Anything for breathing, to improving breathing?
So
do you use mouth tape or?
So this could be, I don't, personally, as I'm not a doctor, I don't advise it really because I'm afraid the client will stop breathing completely. I say, oh my God. So I don't really advise it, but rubbing the corners of the nose, stimulating the large intestine acupressure points here in the small holes, and doing Brahmari pranayama or alternate breathing technique can be amazing before going to sleep, to have a very good breathing practice during the night.
Excellent. Do you see a future where face yoga practitioners and dentists collaborate more closely in the future?
Yeah, I would love to. Yeah, I think we work on the same material. And I feel it can be very complementary for a patient of dentistry interventions to have a face yoga practice at home, so that they are very conscious of what's going on in their mouth, and they can work by themselves on different muscles, either relaxing or toning for the mouth, so that dentistry practices will have even more effect and the aesthetic of the face will also be preserved. So yes, I feel it has a very beautiful future.
I personally find that there's lots of subjects in common. From our discussion, I'm like, wow, she knows about this, she talks about that, she does treatments and exercises with patients, which some of them we also use in our office. So I do think it's very complementary.
Absolutely.
And I'd really like to thank you for your participation.
Thank you too.
And I hope to see a great future where people like you and me collaborate on a daily basis.
Yeah, me too, definitely. Thank you very much.
Where can people find you and where can they find more about your work?
So I have a website, which is sylvielefranc.fr. I'm also on Instagram, sylvie.lefranc, where I'm quite active. And I also have a YouTube channel when I do longer videos. So I try to share a lot of free content, and I also receive people for private sessions in Paris and professional teacher training.
We're going to put the links down below, and then you can also have a look at the newest book, which is this one, which I'm going to put links as well on the bottom. So thank you very much.
Thank you very much.
I hope to see you soon.
Me too.
And have another great discussion. I really enjoyed today's discussion.
Me too. Thank you so much.
Merci beaucoup.
Merci beaucoup.